Hello, in this video we will discuss what is self-medication, what are its causes, what it actually is, its prevalence, and why people do it, including what countermeasures can people take to eliminate this behavior from their lives. Before we jump right in, we asked people this important question and here's what they had to say.
No.
No.
Yes.
No, I don't.
Yes.
No, I don't.
Yes.
No.
Yes.
Before we dive into this behavior, let's see what this pharmacist has to say about self-medication. According to Khan et al. In Pakistan Journal of Medicine and Dentistry, self-medication is the use of over-the-counter medicines, prescription-only medicines, or complementary and alternative medicines without consulting a medical expert. It can also mean reusing prior prescription, consuming leftover medicines, using home supplements and remedies, and using medicines on the advice of relatives, friends, or neighbors who aren't medical professionals. But how prevalent is self-medication? We will see its prevalence in Pakistan as well as in international countries.
The prevalence of self-medication ranges from 53% to 61.3% in Pakistan according to Khan et al.
And according to Aslam et al. 2022, prevalence of self-medication with antibiotics was 32.5% in Pakistan. For example, ciprofloxacin, an antibiotic, had a 42.9% usage rate to treat coughs, colds, runny nose, flu, sore throat, diarrhea, or fever. Let's now look at international countries. According to Afridi et al. 2015, self-medication had a prevalence rate of 68% in European countries and was much higher in developing countries. For example, it was as high as 98% in Palestine. The causes of self-medication may be one reason or a mix of different factors. It's difficult to say why a person chooses to turn towards this behavior, and the skyrocketing rates of self-medication in Pakistan requires a deeper look into understanding what leads to this behavior. Understanding this can help us comprehend the way it works. According to Afridi et al. 2015, some common reasons people self-medicated were to cure ailments like headaches and fever, and some of the most commonly used medicines were painkillers, fever reducer medicines, and cough syrups. From the same study, one common reason for self-medicating among 33.3% of people was previous experiences with similar symptoms. But that still doesn't explain why people resort to attempts to cure illnesses themselves. We uncovered some eye-opening factors, so let's explore. According to Aslam et al. 2022, some underlying factors that lead to self-medication are lack of trust towards doctors, availability of antibiotics at pharmacies, lack of strict legislation over availability of antibiotics without prescription, limited availability of health insurance, and lack of accessible and affordable health care. A common misconception is that heroin or meth is more dangerous than prescription medications. However, prescription medications also include short and long-term consequences that are just as detrimental to a person's mental, physical, and psychological well-being. According to Khan et al., self-medication can lead to incorrect diagnosis, unsuitable drug selection, drug dependency, drug abuse problems, and wastage of medical resources. It can also make symptoms worse by triggering new mental and physical health challenges. How, you ask? By preventing individuals from seeking the professional help they need. Self-medicating can also have two very opposite effects. It can either lead to habituation to a drug, causing withdrawal symptoms if the drug consumption is eliminated, or it can lead to dangerous allergic reactions and drug interactions. As outlined before, self-medication can be dangerous and even life-threatening in some cases. The misuse of medication is a significant public health issue that requires interventions and measures to reduce its prevalence. So let's talk about what can be done. According to the following researches you see pop up on your screen, we found 4 major domains that look at interventions and measures. These domains are education and knowledge, regulation, policy and legislation, research, and healthcare services. Let's look at each of them one by one. First up is education and knowledge. Patient education to explain proper pharmaceutical use and programs for the public can be effective in raising awareness about the consequences of self-medication behavior. Medical education and pharmacovigilance programs can also enlighten people regarding medicine and its uses. Next is regulation, policy, and legislation. This includes formulation of effective national policies on medication access and long-term measures by health policy makers and Ministry of Health. A regulatory system for dispensing medicines should also be set up to hinder self-medication. Another important yet overlooked domain is research. More multi-center studies in different populations and healthcare settings can be conducted to assess associated factors with self-medication. This can help in discovering more productive techniques to reduce this practice. The final domain, healthcare services, looks at healthcare accessibility and affordability, including insurance for the public. On the other side of the coin, capacity building programs for pharmacists, improving doctor-patient relationship, and adequate competency and communication by healthcare professionals can also lessen self-medication. Now, these were interventions and measures discussed on a nationwide or a global scale, but you might be wondering what you can do on an individual level. Let us give you some ideas.
Number 1. Identify your own self-medicating habits and try to avoid them. Number 2. Seek guidance from medical experts before taking prescribed medications. Number 3. Monitor your medicine use. Number 4. Take proper regular checkups. Number 5. Always check expiry date before taking any medicine. Number 6. Always educate yourself about the contents of the label and leaflets that accompanies the medicine. And there you have it. By reducing self-medication practices, we can ensure the safety and well-being of individuals and ultimately improve public health outcomes in Pakistan. Thank you for watching.